Hello, this is Amy Welch. I'm performing my head-to-toe physical examination for nursing class 612 Advanced Health Assessment, Maryville University. Hello, Mr. Welch. My name is Amy. I'm the nurse practitioner at the clinic. Is it okay if I do your physical exam today? Have you emptied your bladder? Okay, did you remove all your clothing? Okay, just hold your drape around you while we go get your height and weight. You just stand up nice and tall against the tape measure. Okay, go ahead and step out. You're 73 inches, so you're 6 foot 1 inch tall. And zero the scales, and then you can step on there. And your weight is 258.4 pounds. Have a seat in the chair. You need to get the rest of your vital signs. I want you to hold that under your tongue for me, please. I'm going to check your blood pressure. It's going to get pretty tight. One 136/76 is your blood pressure. And your temperature is 98.6 degrees. Next, I'm going to listen to your heart. Get your heart rate. Your heart rate is 80 and your respirations are 20. I'm going to begin with inspection of the head and face. I'm looking at the color of the skin, which is a pink tan color. Looking at the external characteristics of the eyes and the ears, which are symmetrical. One is not higher than the other. Also looking at midline positioning of the nose and looking for any facial droopiness, which there is none. Looking at the scalp for hair distribution, I'm also looking for any masses, lesions, any dry scaly skin, parasites. I don't see any open areas of the skin as well. I'll begin with palpating, feeling the skin over the scalp, which should be easily movable. Feeling for any masses, lesions, areas of tenderness. I'm feeling the hair, which feels very fine. He has some areas of alopecia. The hair is not brittle, and it doesn't break easily. Moving on to the face, palpating the facial bones for any masses, lesions, areas of tenderness. Okay, the temporomandibular joint, open and close your mouth. Again. Okay, so there was no popping or clicking or any locking with the range of motion. Palpating the frontal sinuses for tenderness or enlargement, maxillary sinuses, and the lacrimal gland, right below the eyebrow, the lacrimal apparatus. In assessing cranial nerve number 7, the facial nerve, I want you to wrinkle your forehead, close your eyes tightly, puff out your cheeks, smile for me, clench your teeth, and stick out your tongue. Okay, so cranial nerve number 7 is intact. Cranial nerve number 5, trigeminal nerves, assesses for facial sensation. I want you to tell me if you feel sharp or dull with your eyes closed.
Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay, very good. So trigeminal nerve is also intact and normal. Okay, moving to the inspection of the eyes. I'm looking at the symmetry of the eyes and the eyelids. There's no ectropion or entropion. There's no xanthelasma. There's no ptosis. The pupils are round and equal bilaterally. As I look at the eyelashes, they curve outward and upward. There's no crusting. Looking at the conjunctiva, it's slightly pink. There's no drainage and no erythema. Looking at the sclera, it's white. There's no yellowing or jaundice. Okay, next I'm going to have you do a near vision eye chart test. So you want to put your glasses back on. And this is the Rosenbaum chart test. I want you to hold it 12 to 14 inches from your face and covering your right eye. Read the smallest line that you can see from left to right.
F-L-H-T-O.
Okay, now cover your left eye and read the smallest line from right to left.
O-T-H-L-F.
Okay, very good. So your vision is 20/20 with your glasses. You want to go ahead and slip your glasses off again for me. I'd like to assess your pupils. And I'm going to assess direct and indirect. Go ahead and look at the window for me. Assessing direct reaction of the right pupil, it constricts, and indirect, as I shine the light back into the right eye, the left pupil constricts. So I'm seeing direct and indirect restriction of the pupil. The left side, I see the left pupil constrict. Shining the light back into the left eye, I see the right pupil constrict. So he has direct and concentric pupillary reaction. To look at my finger, look at the window behind me, look back again at my finger. Okay, and his eyes accommodate between two objects. So the pupils are equal and reactive to light and accommodation. Next, I'm going to do the confrontation test, which looks at your peripheral vision. I'm going to step in kind of close to you. I want you to cover your right eye while I cover my left eye, and tell me when you see my fingers wiggling.
No. No. No.
Cover your other eye.
No. No. No.
Okay, very good. So we've assessed cranial nerve number 2, which is the optic nerve, in assessing the eye exam, and also for peripheral vision, and also assessing the pupils being equal and reactive to light. We're going to assess any signs of strabismus with the cover and uncover test. I want you to cover your right eye. And I'm looking at your uncovered eye for any inward or outward deviation, which I don't see. Cover your left eye. And I don't see any deviation of the right eye. So there's no indication of strabismus. All right. Moving on to cranial nerves number 3, 4, and 6. We want to test the strength of the ocular muscles and their ability to move in different directions. That's the oculomotor number 3, the trochlear number 4, and then the abducens number 6. And I'm going to use the 6 cardinal fields of gaze. I want you to watch my finger without moving your head. Keep following my finger. Okay, his eyes converged as my finger came towards his nose. So that's all normal as well. Next we'll move on to inspecting the ears. They're symmetrical. I'm inspecting the auricle. I don't see any masses or lesions, and I don't notice any drainage in the external canal. Palpating the auricle, I'm feeling for any masses or lesions, which I don't feel. And I'm going to get the otoscope and look inside your ear. Pulling up and back, I'm visualizing the external canal, which is dry. It's non-erythemic. I see a small amount of cerumen. I see the light reflex. I see the tympanic membrane, which is a pearly gray color, and I see the shadows of the umbel and malleus bones. Moving to the left ear, pulling up and back. I see the left ear canal, and it's non-erythemic. There's no swelling, there's no drainage. There's a small, very small amount of cerumen. And I also see the light reflex. I see the tympanic membrane, which is a pearly grayish white, and see the shadows of the bone malleus bones. Okay, now we're going to do some hearing tests. I want you to cover your left ear first. Okay, and I'm going to whisper something in the back, and I want you to tell me what you think I say.
Apple.
Cover your right ear.
Baseball.
Okay, very good. The next hearing test is called the Weber test. I'm going to place a vibrating fork on the top of your head, and I want you to tell me if you can hear it in both ears or only one ear.
Both.
Okay. Next, we're going to do the Rhine test, which is I'll place the fork on your mastoid bone behind your ear, and I want you to say now when you don't any longer hear it. I will move it to the front of your ear, and you say now again when you no longer hear it. Ready?
Now. Now.
Okay, very good. So air conduction was twice as long as bone conduction, and air conduction was 10 seconds, the bone was 5. Let's check the other ear.
Now. Now.
Okay, good. So there again, air conduction was twice as long as bone conduction. So we just tested the cranial nerve number 8, the acoustic nerve, by using the Whisper, Weber, and Rhine tests, and those were also normal. Next, moving to inspection of the nose, I see that it's midline. I don't notice any masses or lesions. I don't see any deviations in the structure. Palpating, I don't feel any masses, lesions. I'm going to use the scope again to look up inside each nair. And I can see that the mucosa is pink. The turbinates are also pink. There's no blueness or bogginess. I visualize the septum. There's no deviation. There's no polyps or any unusual drainage. In the right ear, the mucosa is also pink. The turbinates are pink. No bogginess or blueness. No abnormal drainage and no polyps. And there's no septal deviation either. I want to check the patency of your nares, so I want you to cover your left nair, breathe in and out of your right. Now the other side. Okay, very good. Next, I want you to close your eyes, and we're going to test a cranial nerve number 1, the olfactory nerve. Close off your left nair and tell me what you smell.
Cinnamon.
Okay. Keeping your eyes closed, close off the other nair and tell me what you smell.
Coffee.
Okay, very good. So we've tested cranial nerve number 1, the olfactory, 2, the optic, 3, 4, and 6 were the oculomotor, and we tested the trigeminal and facial nerves, which were 5 and 7, and also the acoustic, number 8. So moving on to the mouth, I'm expecting that the lips are they're pink, they're moist. I don't notice any chelosis or cheilitis. There's no hepatic lesions. I want you to open your mouth for me and stick out your tongue. Okay, say ah.
Ah.
Okay, and as he says ah, I'm noticing that the uvula and the hard and soft palates are midline. They both rise as he verbalizes. Stick it out a little bit farther. Okay, he's had his tonsils removed. I can see the anterior posterior pillars. I see the oral pharynx. The posterior pharynx is not erythemic. There's no edema. The mucosa and the gums look pink and moist. I don't see any masses or lesions. The teeth are pearly white, slightly tea-stained with some fillings. He has 14 teeth on the top. I'm going to use a tissue here to kind of hold your tongue up out of the way so I can assess underneath your tongue. Okay, I'm also looking for any masses or lesions underneath the tongue, which I don't see. Also looking on the lateral sides of the tongue, and also on each lateral cheek area for any masses or lesions or sores or cankers. And again, the gums are nice and pink. There's no erythema and no swelling. Okay, there's 14 teeth on the bottom as well. Okay, I'm going to assess your gag reflex. So open your mouth for me. Okay, and your gag reflex is intact. Go ahead and stick your tongue straight out for me. Okay, and I'm visualizing the tongue. It's pink, it's moist, there's no open areas, cankers, there's no deviation, it's symmetrical. Move it side to side and up and down. Okay, very good. So there we just assessed cranial nerve number 12, the hypoglossal nerve, and testing for lateral and up and down movements of the tongue, which was normal. We assessed cranial nerve number 9, which is the glossopharyngeal nerve, and that revealed midline positioning of the palates and the uvula, and they both rised when he verbalized the word ah. Cranial nerve number 10, being the vagus nerve, was his gag reflex, which was also intact. So, very good. We just have one other cranial nerve to assess, and that's cranial nerve number 11, and that's the spinal accessory nerve. I want you to push against me, shrug your shoulders. Okay, turn your head left, to the right, extend it backwards, forwards, left ear to the shoulder, right ear to the shoulder. Okay, now I want you to push against me, forward, backwards, to the side, laterally. Okay. Okay, very good. So his range of motion and muscle strength of the head and neck is also intact. Moving on to inspection of the neck. I see that his neck is smooth, is symmetrical. The trachea is midline. I don't notice any areas of swelling, no borders, and there's no masses or lesions. Turn your head left and right again for me. He has no jugular venous distension. And as I palpate, I'm feeling the carotid pulse, which is 2+, the right carotid pulse, and it's also 2+. I'm palpating the trachea to see that it's smooth, it's mobile, I can easily move it. There's no tenderness. I also want to assess the thyroid, so I'm going to go from behind and place my finger right beneath the cricoid bone where the isthmus is and kind of slightly move that trachea to the right as I examine the left lobe. Swallow for me. Okay, and I can easily feel it move up and down underneath my fingers. Okay, now I'm examining the right side. Swallow again. Okay, and it feels very smooth. There's no notching. It's not firm. It's not enlarged. Was it tender? Okay, very good. All right, moving on to the lymph glands. I will start with the occipital, which are at the base of the skull, the postauricular, preauricular, the tonsillar, submandibular, submental, the superficial cervical chain, posterior cervical chain, deep cervical, okay, supraclavicular, and infraclavicular. Okay, I'm also going to assess the axillary lymph nodes, which should be freely movable. They shouldn't be enlarged. They shouldn't be tender or firm. Okay, very good. And I also want to auscultate the carotid arteries with the bell of my stethoscope, as well as the thyroid. And I'm listening for any bruise or swishing or turbulence in blood flow. And also the thyroid. Okay, and I didn't hear anything abnormal. Okay, now we're moving to the upper extremities, and I'm noticing the symmetry of your shoulders, your arm, your elbows. As I'm inspecting your hands, I'm looking for any deviation in the phalangeal joints, which I don't see. The nail beds are nice and pink. There's no cyanosis, there's no clubbing, no fungal nail disease, there's no evidence of any nail biting or picking. The hair distribution is equal, and I see the muscle tone and mass. He doesn't have any lesions or any rashes that I can see. In palpating, I'm feeling the muscle tone, the muscle strength. I'm also palpating down over the joints for any areas of tenderness or swelling. Left arm, muscle tone and strength, palpating over the joints. Okay, I'm also checking for capillary refill in the nail beds, which is less than 3 seconds, so that's normal. I'm assessing radial pulses, 2 plus, 2 plus, brachial pulses, 2 plus, and 2 plus. I'm going to go ahead and assess the brachial reflex. Left. Okay, very good. And now I also want to assess the strength in his upper extremities. Can you hold them out straight for me? They push against me, in, out, down, up, push against me, and pull. Okay, so his upper extremities have good strength. Now we're going to move to the posterior chest wall, so can I have you turn around? If you want to put your glasses on, you can. Starting with inspection of the posterior chest wall, I'm looking for the symmetry as he takes each breath in and out. I'm looking for any respiratory efforts such as intercostal muscle use or any retracting, which he doesn't have. His respirations are even, they're deep, they're regular. I'm looking at hair distribution. I'm looking for any masses. I do see, starting posteriorly, that he has a small 3-centimeter scar to the lumbar sacral area, and as we discussed in his history, he's had a lumbar discectomy in the past. As we move up superiorly from the lumbar sacral area, he has a round nevi, and it is symmetrical, meaning both sides of the mole are the same. There's no difference. The borders are regular. There's no notching. The color is light brown throughout the entire mole. There's no changing in color. The diameter is a little bigger than what we'd like to see. It's 1 centimeter round. And have you had this mole very long? Since you were a child, and you haven't noticed any changes in the color, or if it's tender or painful, hasn't gotten darker. Okay, but you do keep an eye on it. Okay, very good. In palpating the nevi, the borders are more flat, and then the central area is more raised, and there's a small amount of hair growth from the central area as well. So I would document this as a compound nevi. Okay, after inspection, moving on to palpation, starting at the apex of the lungs, palpating over the entire chest wall for any areas of tenderness or any masses or nodules. About the 10th rib, I'm placing my hands horizontally and kind of pinching my thumbs together at the spinal column. Take a deep breath in and let it out. Take a deep breath in and let it out. Okay, and I can see his chest walls on each side. The chest walls are symmetrical, they're even, and they rise together and they move out and return back in. Okay, I want to assess for any kidney tenderness. So at the costovertebral angle, is there any kidney tenderness there?
No.
Any tenderness? Okay. I also want to go ahead and percuss while we're at this area for any tenderness of the kidneys. Okay, very good. Next, assessing tactile fremitus. Each time I touch your chest, I want you to say 99.
99, 99, 99, 99, 99, 99.
Okay, very good. Assessing tactile fremitus, we're listening for the quality of sounds through the chest wall, and his sounded normal, or they felt normal. Okay, moving on to percussion of the lung fields. I'm going to start in a systematic pattern, the apex, percussing down, and we should hear resonance, which is the normal lung sounds. We shouldn't hear any hyperresonance or dullness. Or we could hear dullness if we're over a bone, like a rib. Okay, and percussing laterally, if you could raise your arms up a little bit for me. And the right middle lobe and left lateral. Okay, very good. Next, I'm going to measure diaphragmatic excursion. And in this, I'll have you go ahead and keep your arms out forward just a little bit for me. It helps open up the scapula so that we can get a better feel for the lung fields. I'm going to start with percussing down the scapular line. Take a deep breath in and hold it. From resonance to dullness. Is it okay if I mark on your skin? Go ahead and let your breath out. Okay, now I'm going to percuss from dullness back to resonance. Or whoops, let your breath out, okay, and hold it for me. Okay, dullness, back to resonance. And normal should be 3 to 5 centimeters. And his is 4 centimeters. So that's within normal. Now we'll do the other side. Take a deep breath in and hold it again. Okay, percussing from resonance to dullness. Take another breath. Let it all out. And hold it. Percussing from dullness back to resonance. And then measuring again. And yours is 4 centimeters, so again, that's very normal. Okay, moving on to auscultation of the breath sounds. So take a deep breath for me in and out. Okay, and also listening to the right middle lobe and left lateral. Okay, very good. And I heard vesicular sounds, which are normal. Okay, I need you to turn around for me so we can check your anterior chest. Beginning with inspection, I'm also noticing the contour and the symmetry of his chest. With deep inspiration, he has some symmetrical movements. I don't notice any pulsations or heaving. Noticing the hair distribution, and he doesn't have any respiratory efforts such as using intercostal muscles, or there's no tachypnea. All right, next I'll begin with palpation. Palpation of the chest wall, palpating for any masses, lesions, the areas of tenderness. Palpating for the point of maximal impulse, which is 5th intercostal space, midclavicular line. Right. I very faintly can feel it. Okay, next, assessing for tactile fremitus, say 99.
99, 99, 99, 99, 99.
Okay, and again, he has normal vibrations and sound through the chest wall. Okay, next I want to move on with assessing the breath sounds first. Deep breath in and out. anterior, or laterally, I mean. Slightly raise your arm for me. Again, assessing the right middle lobe laterally. Okay, and we'll also percuss the anterior chest, midclavicular line. Again, percussing for resonance, which is normal sounds. Raise your arms out. Okay, very good. And I heard resonance with the percussing. Okay, moving on, I want to listen first with the diaphragm of my stethoscope to the 5 cardiac regions. First, the aortic, which is second intercostal space on the right. First pulmonic, second intercostal space on the left. Second pulmonic, third intercostal space on the left. Erb's point, which is the third through the 5th intercostal space on the left. That includes the tricuspid, which is at the 4th intercostal space. And then the mitral, 5th intercostal space, midclavicular line. And I can hear a very clear S1, S2. I don't hear an S3 or S4. I don't hear any muffling, no murmurs, no clicks, gallops, or rubs. I want to further assess using the bell, listening for any turbulence in blood flow, or any swishing which could indicate stenosis of a valve. Aortic area. First pulmonic. Second pulmonic. Erb's, tricuspid at the 4th intercostal space. And then the mitral. Okay, very good, and I didn't notice any murmurs. Okay, I also want to assess for any heaves or thrills. A heave would be a more vigorous type of sensation, whereas a thrill is a very fine, rushing type of palpation. So I'm going to start at the apex, the left sternal border. Okay, the pulmonic, or the left base. The right base, the aortic. The right sternal border. And the epigastrium. Okay, and I didn't feel any heaves, lifts, or thrills. So that's good. All right, moving on to the abdomen. I'm going to have you lay down here on the table for me, and I'm going to go around the back side. Okay, inspection of the abdomen. I'm looking at the skin color, which is it's pink. I'm looking for any surface motion, such as peristalsis, which he doesn't have. I'm looking for any bulges or herniations. He does have a slight umbilical hernia. There's no periumbilical cyanosis. As I inspect, he has a fairly large scar to the right lower quadrant, which he told me in the history he's had an open appendectomy in the past. I noticed that with respirations, he has symmetry of the abdomen, and there's no pulsations. Okay, I'm going to auscultate all 4 quadrants, starting with the right lower quadrant, the right upper quadrant, taking up to 5 minutes in each quadrant if needed. Left upper quadrant, and left lower quadrant. Also, listening to the arteries, starting with the aorta, the left renal artery, right renal, left iliac, the right iliac, left femoral, and right femoral. I want to listen again with the bell to see if I can pick up any turbulence of blood flow or stenosis of an artery, aortic, left renal, right renal, left iliac, right iliac, left femoral, right femoral. Okay, and I didn't hear any bruise or any swishing. Okay. After auscultation, moving on to percussion of the abdomen. And as we percuss the 4 quadrants, it should sound tympanic, and it does, like a gastric bubble. And in percussing the spleen, we want to percuss posterior to mid-axillary line. There should be dullness. Okay, we're going to percuss the liver borders next. Percussing midclavicular line from resonance down to dullness. I'll make a mark, and that will determine our upper border of the liver. Okay. And then percussing from tympanic back up to dullness will determine the lower border of the liver. Okay, normal is 6 to 12 centimeters, and his is 9 centimeters, so that's within normal. Okay. Next, I'm going to begin with palpation, light palpation, lightly palpating all 4 quadrants. Any masses or lesions, any areas of tenderness, left lower, right lower, and then I'll begin with deep palpation at the right costal margin. Take a deep breath in, palpating the liver borders. Go ahead and let it out. Palpating for smoothness. The liver shouldn't feel firm or hard, and it shouldn't be tender or enlarged. Deeply palpating the spleen. Take a deep breath in. Okay, and I can't palpate it, which is normal, or otherwise he would have splenomegaly, which would be abnormal. Deeply palpating the left lower quadrant, the descending colon, the sigmoid, into the right lower quadrant, which would be the ascending colon, the cecum, and back up towards the hepatic flexure. Okay. I also want to palpate for any kidney tenderness. Deep breath in. Okay, any tenderness there?
No.
And I can't palpate the kidneys. Any tenderness there?
No.
Okay. All right, very good. I also want to feel for any aortic pulsation, so I'm placing my thumb on one side of the aorta and my 2 finger pads on the other side, feeling for aortic pulsations, noticing if there's any lateral swishing that would represent lateral blood flow, and that could indicate an abdominal aortic aneurysm, and you don't have any of that, so yours is normal. Once you lift your head up off the table, okay, and as he does that, I do see a small amount of herniation. So superior to the umbilicus, and including the umbilicus, he has a small area of herniation. While you're laying there, I also would like to assess the contour. I need my light from the side. Since we saw that herniation, but I don't notice, he has slight roundedness of the abdomen, which is normal, but the contour appears normal. I can't tell that there's any bulging from that aspect. Okay, now we'll have you go ahead and sit up. Need some help? Okay, in assessing and inspecting the lower extremities, I'm looking for symmetry of both legs. Looking down the legs at hair distribution, I'm looking for any edema. I'm looking at the joints of his feet, also looking at the nail beds, which there's no clubbing or cyanosis. The nail beds are pink. There's no fungal infection, and there's no deviation or any swelling of the toes or erythema, which could be gouty arthritis. So I'll begin with palpation, feeling the muscle tone and mass of each leg. Noticing the temperature of the extremities, also feeling for any edema down the tibia. Palpating the foot and the joints of each foot for any tenderness or pain. And also assessing the nail beds for capillary refill, and those are adequately blanching in less than 3 seconds. And feeling for the dorsalis pedis, which is 2+, and 2+ on the right. The posterior tibial pulses are also 2+, and the popliteal pulses, which are 1+. Okay, again, I want to assess the strength of his lower extremities. So I want you to press against me, press in, press out, press back, press up, and press down. Okay, so his strength to lower extremities is also intact. I'm going to assess the rest of your reflexes, finding the patellar tendon. Okay. Achilles. Okay, very good. So those were normal. Now, in assessing sensation, I want you to close your eyes and tell me if you feel sharp or dull.
Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull.
Okay, the upper extremities.
Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay, very good. Now we want to assess a 2-point configuration. I want you to also keep your eyes closed, and I'm going to poke you with a pin. I want you to tell me if you feel 1 or 2 pokes.
2. 1. 1. 2. 1. 2. 1. 2. 1. 1. 2. 1. 2. 1. 1.
Okay, very good. And the closer that the needles are together, sometimes they will only feel 1, which is normal. Okay, I'm going to have you stand up and put your back towards me. I'm inspecting his spinal column, noticing that it's straight, there's no curvature, there's no deviation. I don't notice any masses or bulges. Can you reach over and touch your toes for me? Okay, and I'm going to palpate up the spine, noticing any areas of tenderness, any bulges, herniations. There's no rib humping or lateral curvation at all, which would represent scoliosis. And palpating the cervical spine, it's concave, as well as the lumbar spine. Okay, so no kyphosis, there's no scoliosis, and no lordosis. Okay, go ahead and stand up for me. Now, I want you to bend to the right, bend to the left, bend back as far as you can. Okay, very good. And then squat down. Okay, when he does this, I'm assessing the strength of his upper legs as well as his balance and coordination. Okay, I believe that that ends the physical exam. Do you have any other questions or concerns? Okay, thank you very much for allowing me to do your exam. This concludes my examination. Thank you.